Wouldn't it be amazing to see health and care without boundaries? The NHS working with local authorities for the benefit of the local population. Now that would change everything.
District councils aren't funded for public health, but they do provide a range of services which are absolutely critical to people's health. For example, housing, environmental health, leisure, critically, planning and the management of open spaces. This project came out of a conversation that I had with the GP. That got me thinking about issues that the District Council could help with. We brought in a health coach.
Push your heel.
We jointly funded that position along with the GP surgery and also our leisure providers, Freedom Leisure.
Lovely, excellent.
Alan and I retired 20 years ago. We had a really good 20 years of healthy, smashing times. We were very lucky. Things began to change when we both got to our middle 70s. Alan had the beginnings of dementia. Unfortunately, he did succumb to that rather nasty disease, and I found myself without him after 53 years of marriage, which not good. Music had been my life. In the weeks following Alan's death, I gave away all my music. I was isolating myself. The doctor said, would you be prepared to see a health coach?
Angela is typical of the type of patient we get in the health centre. We have a rural population. A lot of our elderly patients live on farms, which can be very isolated. They very often have a significant number of long-term medical conditions. 20% of patients make up close to 80% of the workload. A lot of their issues could be dealt with very ably by a lot of our community partners.
The reason this is different from other health coaching is because it is direct referral from doctors, so they're sending me their patients because they clearly want me to see them. It might be people who've had stroke, it could be people who are recovering from cancer, it could be people who again are just socially isolated. By actually putting them in walking groups, it teaches them to start to enjoy walking again, and obviously increasing benefits of our cardiovascular system, improving mood and well-being, helping to reduce anxiety and depression, and also they can meet people.
During the course of seeing the health coach, I discovered that there was a choir starting up, and to my absolute amazement, I enjoyed it.
When you sing, you have to breathe. So when you're breathing, you're helping your diaphragm. People who have pulmonary conditions particularly, it's beneficial because it helps them breathe more evenly.
We're giving people the tools, the skills to self-care, to self-regulate and to manage their condition, and therefore feel so good in themselves, about themselves, with what they're achieving. That makes it sustainable.
From my perspective as a GP, I think there are two things that would really help for the future. The first is we need to find ways to keep people well at home, to empower them to look after themselves at home. And the second is to think about wider determinants of health, particularly things around housing, parks, planning, education, because all those things will be the things that actually help people stay in their own home and keep well.
This project has now been expanded, courtesy of the Clinical Commissioning Group, to cover a much wider area. The message to NHS colleagues will be engaged with your district councils. They've got an awful lot to offer. They can help you with planning issues, in particular on healthcare infrastructure. But critically, they've got community leadership skills. To district councils, you know there's nothing more important to you than the health and well-being of your residents. The services you provide are a perfect opportunity to engage with healthcare colleagues to try to ensure the maximum benefit for the people you represent.
2, 3.
It has kick-started me into really thinking about my health, what I'm doing in the years that I've got left. I feel good.